Hello, and thank you for your time today. My name is Hannah McGinty, a Health Promotion Officer. Today, I'll be taking you through a comprehensive, multi-level health promotion plan to assist in increasing the physical activity among middle-aged men living in Dorset, a rural LGA in Tasmania. Today, I'll be using the Victorian Department of Health Integrated Health Promotion Planning Framework to work through the health promotion plan. I'll be focusing on the section surrounded in blue, planning items 1 through to 3, starting with the vision. The vision will be representative of how our key stakeholders will work together. During a needs assets assessment, the following partners on the right-hand side of the screen were discovered. To understand further who our key stakeholders will be, I've devised a partnership plan using the Vic Health framework. In the top left-hand corner, we have our networking partners, such as the Department of Health and Human Services, Get Moving Tasmania, AFL, and so on. We will work together and exchange information. In the top right-hand corner, we have our coordinating partners who will be more involved and will exchange information as well as alter current activities where required. Moving on to the left-hand side, down the bottom, we have our cooperating partners, which we will develop a strong relationship with and will rely on their support in sharing resources. We have the Dorset Community House and the Dorset Council. Finally, on the right-hand side, down the bottom, we have our collaborating partners who we were required to assist in implementing the health promotion activities. The Scottsdale and Bridport Football Club. A further understanding of the partnerships and how we will work together will be provided later in today's presentation. Now, let's look at Tasmania to begin. Currently, they have the highest rate of overweight or obese adults in Australia's population, with 70.9% within this category, with a larger portion of men overweight or obese at 76.7% compared to women at 65.3%. Based on these statistics, we'll be focusing this plan towards men. Why? Because we know that excess weight, and in particular obesity, is a major risk for type 2 diabetes, cardiovascular disease, and overall poor heart health. Yet why Dorset? Firstly, Dorset is a rural local government area located in the northeast of Tasmania. According to the Australian Bureau of Statistics, in 2016 census, it was reported to have a population size of 6,617, with a split of 52% men and 49% women, with the median age of 48 years, which is why we'll be focusing our plan on the middle-aged 30 to 65 years old. According to the socio-economic indexes for areas, the Dorset LGA scored 918 in the 2016 census, making it one of Tasmania's most disadvantaged LGAs. The Dorset adult population also did not meet the Australian Physical Activity Guideline, with 14.8% not meeting the moderate to vigorous activity standard and 75.6% not meeting the muscle strengthening standard. With the goal to increase physical activity among middle-aged men that live in Dorset, a rural LGA in Tasmania, we start with our first objective: to increase physical activity through the engagement of social and team-orientated activities amongst middle-aged men 30 to 65 years old in the Dorset LGA in 2022, with the strategy to collaborate with existing sporting clubs and active recreation providers to provide innovative new ways to increase physical activity through social physical activity. The self-determination theory can assist with a change at the intrapersonal individual level. For example, a pilot study in Perth observed great results in overweight, obese middle-aged men as they took part in an Australian Football League inspired setting. The aim of the study was to understand if self-determination is important in maintaining motivation to change health behaviours. The study applied the self-determination theory principles through coaching, and program activities that overall assisted in strengthening the quality, quantity, and longevity of motivation to change behaviours. We will be collaborating with our partners, the existing football clubs in the Dorset area, Scottsdale and Bridport, to provide innovative programs for the wider football community, such as the brothers, fathers, and friends of current members, as this will increase the opportunity for the sporting community to open up a program to a new set of people. Ultimately, building a new community through types of sports can ensure empowerment and sustainability of the program, not just the continuation of the program, yet becoming change agents to their wider community that may not be affiliated with the sporting facility. It also creates a sense of community, a social peer support group, which empowers participants to become change agents of their own. Objective 2 will be to increase the number of opportunities for middle-aged men in Dorset to participate in physical activity by reducing financial barriers by the end of the 2022 calendar year. Our strategy is to introduce free physical activity events into the Dorset community. The theory of change relevant to this objective is shown through the social capital theory at the community level. A study into the park run by Wiltshire and Stevenson demonstrated that reducing financial barriers in the participation of physical activity in lower economic groups, such as Dorset, can increase physical activity. We'll be cooperating with our partners, such as the Dorset Council, as it's crucial to ensure the space we use and the facilities are available and legal for use. We'll be collaborating with the Dorset Community House to help run these events and search for volunteers. Or we will be using their facilities, their headquarters for yoga classes and other physical activities. And finally, we'll be networking with all our coordinating partners to spread the word of these new events and invite to collaborate for the future. Using volunteers in these types of events increases our community capacity. It creates opportunities to volunteer in the community and addresses and shares an awareness of the community, creating a stronger sense of community for the long-term initiatives to continue and be stable. Objective 3 is to increase education to physical activity providers around self-efficacy and safe and positive environments in 2022. Our strategy is to develop and distribute educational material to physical activity facilities and work with them to create positive environments. The theory of change relevant is the social cognitive theory at an intrapersonal environmental level. With a focus on self-efficacy, a study by Young et al. Found self-efficacy can be replicated in physical activity environments, such as football clubs and gyms, through the simple act of social persuasion, which involves kind words of encouragement, positive environments, and coaching feedback. Ultimately, creating a safe and positive environment, which can be replicated in the Dorset physical activity environments, such as the Dorset Flex Gym, Squash Club, Scottsdale and Bridgeport football clubs. Our partners here can really assist. However, we do have some practical issues. If executed correctly, which we'll need to monitor, we should see sustainability in attendance in these sporting locations. Young et al. Also speaks about the increased self-efficacy resulting in sustainability of behaviour change. Working with these partners, perhaps conducting workshops, could result in positive outcome in behaviour changes for the Dorset community. Thank you very much for your time. Please see my references below. Thank you.